This November marks the first presidential election since the Supreme Court overturned Roe v. Wade with the Dobbs decision in 2022, sending the issue of abortion back to the states. Abortion is considered one of the pivotal issues in this race, so it may seem no coincidence that the Biden administration launched a new proposal this week regarding contraception. The measure would allow millions of people on private health insurance to pick up condoms, birth control pills, and even morning after pills, all free of charge and without a prescription. The Catechism of the Catholic Church calls contraception a morally unacceptable form of birth regulation, adding that every action that proposes to render procreation impossible is intrinsically evil. All right, let's bring in Natalie Dodson, policy analyst with the Ethics and Public Policy Center. Natalie, great to be with you today. As we mentioned, this proposal requires insurance companies to remove the prescription requirement coverage for contraception. Talk to us about what kind of dangers that could pose, especially to one's health.
Well, I want to be really clear here. This is a political stunt. It's a proposal that cannot be finalized before the 2024 election. What it reveals is that a future Harris administration's primary concern would be reproductive rights at the expense of religious liberty and the health of women. Just last year, the Food and Drug Administration approved the O-pill, a progestin-only contraceptive pill that is the first ever over-the-counter form of hormonal birth control. This proposed rule would mean an unprecedented level of access to a drug with no age restrictions. O-pill is currently available in pharmacies and retailers, including CVS, Walgreens, Target, Walmart, Costco, and Amazon for as little as $20 a month or $90 for a 6-month supply. There's a serious safety concerns with the over-the-counter oral contraception, especially for women as young as 12 years old, who without parental consent or the approval of a medical professional would be able to obtain birth control at no cost.
And Natalie, let me ask you this too. What other potential issues, if implemented, could this proposal pose?
Yeah, we have seen for many years since 2010 and the enactment of the Affordable Care Act, the contraceptive mandate 1.0 has been in litigation, especially with Little Sisters of the Poor. And HHS has said that they would respect religious liberty, especially with the wins that we've had with the Supreme Court in Little Sisters of the Poor and Hobby Lobby. But it's unclear whether they will still respect these protections won in litigation. Even though the Little Sisters of the Poor won their case, they continue to be embroiled in litigation 13 years later. This proposal additionally threatens moral and conscious objections for employers, pharmacists, and retail staff, especially coupled with another proposed contraceptive mandate rule that seeks to eliminate the moral exemptions in its entirety. Vice President Kamala Harris recently shared that she would reject religious exemptions for abortion as president, which likely means she would take the same view for contraception.
Natalie, thank you so much for weighing in. We really appreciate it. God bless.
Thank you.